finding the recalls group? Yes, recording has been started. So guys, are you finding the recalls group helpful for your studies? That's great. That's great. And let us start our today's topic. Genetics for MRCOG1. I'm Dr. Mehwish with you in this session. And guys, thank you. Thank you so much. Thank you so much. Dr. Salma, Dr. Maliha, thank you so much. I really wish that you guys get the purpose of that group. We're discussing the recalls just for the sake. Guys, is my voice clear now? I believe host muted everyone and he muted me as well. And I had started talking and probably you couldn't hear anything at all. Actually, I was reading the slides. Okay, let's start again. I'm Dr. Mehwish with you in the genetics session. We started pedigree analysis topic and I was asking if you people like this topic and if you are afraid of this topic or if you just don't feel anything about it because you don't have any idea about the difficulty of this topic. So, yes, Dr. Sophia, is this your favorite topic? You are afraid, Dr. Naira is afraid. Not so favorite. Okay, Dr. Maria has no idea. All right, this no idea category is a better one because it's not a very difficult topic actually. You only have to follow these three steps. You only have to follow these three steps. First step, you will do this concept building thing. Okay, you will build a concept. What concept? That why you have to solve the pedigree charts. This should be very clear. 10 types of disorders and pedigree charts. Practice, obviously, you will practice. And you have to form the trees and graphs. Dr. Sophia, you don't have to form the trees. I know you are saying charts, the trees. They will give you a chart and they will ask you to diagnose the chart. They will ask you to diagnose the inheritance pattern from the chart. So we will learn today that what concepts you need, and how you're gonna solve the question in the exam, and what kind of questions they are going to ask in the exam, so that you don't distract yourself a lot. You know, always I tell students that if they are asking one question from CTG, if they are asking only one question from Pedigree, and if they are asking only one question from calculations, you don't have to spend your whole life on that topic. Yes, Dr. Amber has got this question. How many SBAs from the genetics? Dr. Amber, if you are done with the introduction session, I have already told you like 9 to 10 questions. And many times they don't ask pedigree charts in your exam at all. In many exams, there is no pedigree chart at all. So learn this topic, because I know this is kind of difficult for the students, but don't make it a big problem for you, because this is actually not a problem. So let's get more information. We have students waiting in the waiting room. Probably they have not joined. Okay. So, Dr. Naira, I want you to tell me that what do you know about autosomal and X-linked disorders? Because I want to assess that what is your background knowledge about it. Yes, my dear. Dr. Naira Gul. Dr. Naira Gul.
Yes.
Yes, Dr.
Hello.
Naira. Yes,
Yeah.
I can hear you. So, what is your background knowledge about autosomal diseases and X-linked diseases? Just give me one line so that I can access that you have some information.
In autosomal pattern, it is transformed. The condition is transferred from parent to child.
Okay.
Yeah, and in X-link, either sex is involved.
All right. Um, it's kind of let's see if we have to do some more discussion on this. A lot of students
Yes.
are sending this message that they are unable to join the meeting. Yes. All right,
Wait,
Dr.
wait,
Naira,
wait,
I
wait.
would request you to turn off your
Yeah,
mic.
yeah.
Thank you so much for
Yeah.
participating.
Please. 1 minute, 1 minute. I'm just wait. Wait.
Guys, before starting the actual topic, you have to give me just 1 minute just to set the settings of this meeting a bit. It will be very easy for me to manage the meeting then. Just give me 1 minute. Okay, so guys, as you all know that this meeting is all about interaction, and it is all about having a good time with each other, in which we are learning and we are trying to reach to a good learning level, after which you can solve the questions easily. So I'm giving you this information that in the charts of pedigree, you will find these kind of shapes. On the left side, you have this square colored one, and this is presenting a male. A round or a circle will present a female. When they have shaded the area, this is about the presence of a disease. Okay? If the person is showing the disease, it will be colorful. If the person is not showing the disease, it will be blank or white. Okay? But if you know that the person is a carrier of the disease, then guys, it will be half shaded or they will mark a dot inside. Okay? They will mark a dot inside. And also you have to remember this very important point that if you don't know anything regarding the presence of the carrier trait, then in the charts, person will be shown as non-diseased. Okay, I'm revising this thing. If the shape, circle or square is shaded, fully shaded, like the first situation, the person will be showing the disease, the presence of disease in his phenotype. If it will be empty or no color inside the shapes of circle and square, there will be no disease at all. This is the second situation. And if it will be half shaded or it will be having a mark or dot colored inside, then person will be carrier. There is also another situation that person can be carrier, but you don't know about his carrier state. Then they can show it as a non-diseased person. Why? I'm asking you why. Why we are making careers non-diseased people? Yes, Alishba, what do you say? In your charts, you are marking career people as disease-free people. Why? Because they don't show the trait. And how important it is for us to know about this thing. It is very, very important because if they are carriers and they are passing on the disease into their children, we should know that from where the disease is coming. Okay. There is another thing that you can see. There is a female. I will say F is for female. And then there is a male. If they are mating, they have written marriage line. It's actually, it should be mating line. We are not concerned about the marriage thing here. If they are mating together, they will be joined together by this line. Then this is line of descent. And after this line of descent, if they have produced kids, those kids will be shown with the lines like this. If there was another kid, it will be marked by this way. If there's a fourth kid, it will be marked by this way. It will be shown by this way. Okay? No matter how many kids they have got, they will be drawn like this. So this is the sibling line and generation number. This was the first generation. This is the second generation. So this is all about reading a pedigree chart. Okay? This is all about reading a pedigree chart. Good news is here. Good news is here for MRCOG 1 students that guys, they don't give you complicated and very, very difficult kind of charts in the exam. They don't give you difficult kind of charts in the exam, very, very complicated ones, because they actually want you to pass the exam. They won't give you something which you can't diagnose and you will lose a mark. They don't do this. Now, guys, I'm now behaving like a student, okay? And you all are my teachers, and you have to tell me answers of these questions. We have 5 questions in front of you. So firstly, if I know nothing about phenotype and genotype, please tell me, help me solving this first question. What is phenotype and what is genotype? Yes, Dr. Aruj. Phenotype is physical appearance, Dr. Sophia Shah is saying. Well done, Sophia. What Aruj has to say about genotype? Lishma has come up with an answer. Physical traits, phenotype. Genotype is genetic load. Well done. Genotype is genetic makeup. Well done. We have Dr. Rani here. Genotype is genetic material. Well done. Amber Fazal is saying genetic makeup is genotype. Good. So, guys, if these two things are different, I'm a person. I'm I'm a person. I have a name. From my head to toe, you can see a lot of characteristic physical appearance and a lot of characteristics in the body. Like I have a specific color of my eye, and I have a specific height, and I have inherited a lot of things from my parents and from my grandparents. But I also have a DNA inside myself. That DNA, that DNA inside my body is called genotype. It can have a lot of things which are not shown in the physical appearance. So phenotype is all about the physical appearance and genotype is our DNA. Let's move to next question. Question number 2. What is a dominant thing and what is a recessive thing? We're not talking about disease. We're not talking about characteristics. Just tell me what is dominant and what is recessive. Great answer. Dominant is showing the trait or the disease. Recessive is not apparent but have the trait. Okay. Dominant is one allele. All right. Recessive is two allele. So if we define these two words in very simple words, we will say dominant is strong one, visible one, visible. Okay. And recessive is the hidden one. Am I right? If something is visible and it's strong, we call it dominant, and recessive is the hidden one. So this is a very easy definition. And we will use this knowledge of dominant and recessive in the coming slides. Now tell me, who is a carrier? Who is a carrier? Is he recessive or dominant? What do you know already about a carrier? Yes, Sophia. Yes, good. We are going to discuss this in detail. So tell me about the career. Is career the person showing the characteristic or the trait or who passed the disease? Okay, who passed the disease? Is career person is showing the disease? Which carries gene of the disease? Very good, Dr. Amber. Sophia is saying career has genotype and can transfer, but no phenotype. Well done. Well done. This is what I'm asking. Career will not show the disease, so he is a recessive person and he is hiding the disease inside the DNA in the genotype, and he can pass on this disease into his children. Okay. Now, the difference of this thing that how much mutations in the alleles can pass on the disease is different for dominant and recessive diseases. So we will discuss it so that you can make a concept here. Let me tell you. If there is a disease which is dominant, firstly, I will tell you that every person has two genes, and per se, this is the gene for cystic fibrosis. We're talking about this disease, cystic fibrosis. Cystic fibrosis is an autosomal recessive disease, and we know that if a person is having one mutated gene, he is the carrier of cystic fibrosis and he will not show the disease. But if he is showing the disease, that means he has two mutated genes. Two mutated genes. This concept is applied on to this question number 5 also. We will discuss after the question number 4. But guys, if a person is affected from a dominant disease, then only one mutated gene is enough to show up in the person. Give me an example of a dominant disease. When I said dominant disease, autosomal dominant per se, autosomal dominant disease is what comes into your mind. Adult polycystic disease, it was coming into my mind as well. So we will say adult PKD. So that disease, Huntington, okay, Marfan, good. So that disease will be visible in this person if only one mutated gene is present. And if this person is passing on this mutated gene into the children, he is passing this disease as well. So we call it dominant. We call it strong. Okay. And the recessive one, if he is having one affected gene, one mutated gene, he will not show up the disease. And if he is passing on this chromosome, this gene into the children, he will also not show the disease because he will also become a carrier. In the recessive diseases, guys, a person will only show up the disease if he has two mutated genes. So now let's talk about this question number 5 now. Let's leave the question number 4 for a while. Now we are talking about homozygous and heterozygous. Who is homozygous and who is heterozygous? Let me tell you, if a person has two mutated genes in the genome, he is homozygous for that disease. And if the person has only one, then he is heterozygous. Is this clear? Is this correct? Are you following this? Yes, what do you say about it? Seems like everyone is good about this point, and this point is super crystal clear for everyone. So, in a dominant disease, now we will summarize everything we have studied. In a dominant disease, if person is heterozygous, will he show the disease? In a dominant disease, guys, if you have a heterozygous person, is he showing up the disease? In a dominant one? Yes, he will show the disease. Now, why no? A heterozygous person who is having only one mutated gene and he is having this dominant condition, he will show the disease. Guys, he will show the disease. He's not a carrier. In dominant state, we don't have a carrier. But in a recessive case, we will only have a diseased person if the person is homozygous for the disease. Yes. So let's talk about the question number 4 now. Question number 4. Define autosomal and sex chromosomes. You will define this. This is a very simple, very easy question. Autosomal chromosomes and sex chromosomes, what is the difference? The difference is the chromosome number. Okay? Guys, it's better to send the messages in the chat box rather than sending me the private messages. It's very difficult for me to leave the meeting and go and check the inbox in the WhatsApp. So better to answer the questions here. Yes, correct. We have 23 sets of chromosomes, 23 pairs of chromosomes. Only one is sex chromosome pair. 22 are autosomes. And this one, we have X and Y for the male and X and X for the female. Well done. Guys, in live meetings, active participation, it counts a lot. If you are sitting in a live meeting, that means you are sitting with your teacher in a classroom. So you should get a lot of benefit from this live meeting in a way that you should interact, you should answer, and this way you can learn best. All right, all the answers are correct. So now all these 5 questions, which I promised that we will make this concept building thing first, are done, and now we will start autosomal dominant and recessive inheritance. Autosomal, you have just told me, guys, that 1 to 22 are the autosomal chromosomes. So anything which is related to these chromosomes, it's all right, Dr. Rishpa. You just listen. Don't participate by opening your mic. If you can answer the questions in the chat box, very good. Other than this, you can play the recording. And if you are hearing my voice clearly, then it's fine. Now we are discussing dominant and recessive conditions which are related to autosomal chromosomes. I have this wonderful picture here, this one. You can see autosomal dominant inheritance pattern on the right side, on the left side of the slide, and autosomal recessive inheritance pattern on the right side of the slide. Now we will see what are the differences in the inheritance. Every time, if there is a parent who has one mutated gene, you can see these two chromosomes here. One is mutated, blue one, and other is normal gene. And other parent is totally fine. He is a healthy parent. He has both genes unmutated or totally healthy. Okay. Now, guys, they are showing that every time they are producing the children, what are the chances of having normal and healthy children? What are the chances of having affected ones? In the dominant diseases, we decided in the dominant diseases that one mutated gene is enough to show the disease. Are you following this thing? One mutated gene is enough to show the disease. So this blue color is all about the disease. So every time this parent is transferring this mutated gene into the children, he is making the baby disease. Okay. Can you see two healthy and two diseased children? So there is a 50% chance that whenever they produce a baby, there is a 50% chance that he can get the disease. Why? Why these 50% of the babies are getting the disease? This is the point which we are going to clarify in the discussions. Because here we are about to learn the trick which they will not tell you in the books actually. Yes. Okay. Let me give you this understanding by drawing a thing for you in this blank slide. Let's change the color of our marker. Okay. So guys, there is a parent who has these two healthy genes. Okay. Yes, affected or not affected, there is no carrier in the dominant. Very good. And then we have a parent who is having one mutated gene. Okay, one mutated gene. Now, let's see what are the chances in the babies. In the first baby, guys, why we are taking only one chromosome from each parent? This is my question. Why we are taking only one chromosome from each parent? Only one. Why can't this healthy parent can give two chromosomes to each baby? Is this possible for a parent to give two chromosomes to a baby? What is the role of haploid gametes here? See, I'm giving you all the hints. I'm giving you all the hints. Every time a parent is producing a baby, every time, they will send, like we have a 46 chromosomes total, they will only send 23 in the gametes. Okay, so every chromosome will be divided in half, and there is a fair chance that he can send this healthy chromosome to one baby, and there is a fair chance that this affected parent can send this mutated chromosome to the baby. Okay, now another possibility is this: we have a healthy baby here. Are you following this? Again, we have a diseased baby because he is getting this mutated gene from the diseased parent. Good. And then again, we have a healthy baby because both chromosomes are unmutated from the parents. This is all. So there is a 50% chance that this person who is the parent who has got the disease, he can transfer the disease into the babies. There is 50% chance. Okay, 50% chance. Remember this thing. If this is clear, now I want to draw the recessive inheritance pattern. Firstly, tell me if the dominant inheritance is clear to you. Yes. Now, guys, now we are talking about recessive inheritance. One parent healthy, other is having one affected gene. He is a carrier. He is the carrier of the disease. He is not showing the disease at all. He is the carrier of the disease. And this is a recessive disease. Now, this is an autosomal recessive. So what we can do, we can check if babies will get the disease or not. How many babies are going to get the disease? Yes. The first baby. Is he showing up the disease? 25% are going to get the disease. In this situation, let me check and tell you that is your answer is correct or not. Guys, 25 is the bad answer. 25 is a wrong answer. Actually, 50% of the times, the babies can inherit this mutated gene, and if this person is carrier with 50% carrier, very good, or some is very good. 50% are becoming, chances of making the baby's career are 50%. And 50% of the times, the babies will be healthy. This is for the recessive situation. Now, tell me, if you get a situation, if you get a couple in which one parent was completely healthy and other is homozygous for a recessive disease. Homozygous for a recessive disease, what is the meaning of this word? Homozygous for the recessive disease means that he is showing the disease. Now, what will be the situation? Will you get all the people, all the time careers? All careers. Very good. This is also true for a recessive situation. Then there is another situation in which both of the parents are carrier. When both of the parents are carriers of the disease, what's going to happen? 100% carriers when one parent is homozygous for the disease. And if both are carriers, this, this mother is carrier, this father is carrier, then what's going to happen? One healthy baby, other will be a carrier. Then we have a carrier. And there will be one baby who is getting this mutated gene from both the parents. So yes, you are right. All of you are giving correct answers that 25% of the times the babies will have this chance that they can get the disease if they get both mutated genes from the parents. 25% of the times they can be all healthy, and 50% chances they can become a carrier of the disease. So this is how, guys, this is how you solve your pedigree charts. This is how you solve your pedigree charts. You have to build the basic concepts. No one will do this for you. No one will do this for you. You have to build your basic concepts. You have to solve them like riddles. You have to understand this fact that if you understand the basic um, terminologies and you understand how the disease is transferred into the babies, then you can easily solve this. Now, again, we are back to this slide and you can see that autosomal dominant inheritance, what we discussed and what we drew, it was clear. Now, one carrier parent situation is this. And if we want to see what happens when both are the carriers, then guys, you have one disease baby, two carriers, and one normal baby. Actually, we shouldn't say that one normal baby, 25% chance of having a normal baby. This is the correct line. So 25% is the chance, and can we write it as 1 by 4? Yes, Dr. Misbah. Can we write it as 1 by 4? 25%. So there are exam questions, guys, in which they say 1 by 4% chances of having a disease baby. So this is going to be a true answer. So don't get confused if they say 1 by 4, and don't get confused if they say 2 by 4. Just remember that they are talking about 50%. So far, you have understood this concept very well, and I totally believe that when we will start the genetics discussion, we we can revise and solve the questions very easily. Now I want you to understand that there are some other kind of questions in the exam in which what they do, they only ask what kind of inheritance this disease is. Yes, 1 by 4 is 25%. So autosomal dominant disorders, they are Huntington's disease, Marfan, achondroplasia, neurofibromatosis, osteogenesis imperfecta, and PKD, adult PKD. Okay. We have autosomal recessive as well, cystic fibrosis, sickle cell anemia, Tay-Sachs, albinism, phenylketonuria, thalassemia, avon-trypsin deficiency, hemochromatosis, and Wilson's disease. I have written the names of these into these slides. You can take the screenshot, or these things are discussed in the questions as well. They can give you a question like sickle cell anemia is showing what kind of inheritance pattern. So you can say autosomal recessive, or else they can ask Marfan syndrome is having what kind of inheritance pattern. So you will say autosomal dominant. That's all. Save your scores by this very important information. Okay. Now we will revise. What else they can ask in the exam, we will revise. Features of an autosomal dominant disorders, guys. In autosomal dominant disorders, if parents are affected, 100% chance of having affected babies. 100% chance. If parents are healthy, there is no chance they can have affected babies of this dominant condition. Okay. We call it skipping of generation. So this skipping of generation is not present in autosomal dominant conditions. Who can tell me what is skipping of generations? Yes, what is skipping of generation? I will definitely show you this phenomena in the pedigree charts, but I want you to tell me what is your understanding of this line, skipping of generations. One generation will be skipped, or else you can say that parents will not show the disease and children will, or else you can say that children are healthy but parents are having disease. So this is called skipping of generation. And this very important thing that one mutated gene is present and person will be diseased. Okay, that's all. These points are so important regarding exam that they can make SBAs out of them. They can make SBAs out of them. Everything I have written, everything I have summarized in this class is actually according to the questions they ask in the exam. And these are the features of an autosomal recessive condition. Recessive, the difference you will see now. Affected parents can have healthy children. Why? Because they were, if they were homozygous of the disease, or if they were carrier of the disease, they can have totally healthy children. The children will also not show the disease in the phenotype. Healthy parents can have affected children. When both of them are carriers of the disease, they can produce diseased baby. Okay, so there is skipping of generations. The disease skipped the disease from the parents, and the disease was shown in the children. So there was a skipping. Okay, if there is one mutated gene in the genome, the person will be a carrier, and the diseased person will always have both genes mutated. Okay, don't worry if you can't memorize everything quickly. You will revise from the recording, and obviously I will give you the notes to understand and learn this topic more. So don't worry about it. Okay, we have a question. One generation is disease free. One mutated gene with one or both alleles affected can cause the disease. One mutated gene with one or both alleles affected. There can be one situation only, Dr. Alishba. You either can have one mutated gene or you have both of the genes mutated, or you are totally disease free. Okay, okay, my dear. I want one of the doctors to read this slide for us. And then I will ask that if this information is correct or not. Who will volunteer to read the slide? Dr. Rabia or Dr. Alia?
Hello.
Hello, doctor.
Okay. So a child who has a parent with a mutated gene has a 50% chance of inheriting that mutated gene in autosomal dominant. So if one of the parent is affected, there will be 50% chance that the child is also affected.
50% chance. We
Yes.
discussed this in the chart as well. So this is a correct statement and this is an important information. They can ask this person in the exam as well. Okay. Can you read this slide as well?
In autosomal recessive, 0% affected children if one parent is normal and the other is heterozygous or carrier. Okay.
So your friends will tell you that this statement is correct or not. What this right side of slide is showing, autosomal recessive inheritance in one carrier parent and one unaffected one. And you can see that 50% of the times there are carrier children, 50% of the time there are unaffected ones, but there is no diseased baby at all. So 0% chance of having the disease if one parent is carrier, 0% chance. So whatever you were reading here is true, okay? In AR, 0% affected children if one parent is normal and other is heterozygous or the carrier of the disease. This is another exam question. Now another one.
In autosomal recessive,
Yes,
in autosomal recessive, 25% chance of having a diseased child if both parents are carrier.
if both parents are carrier. So we have to go back and check when
Yes.
both parents are carrier, what are the chances of having the disease in the children?
25%.
Can you see?
And
25%. Well done. So all the charts are described in these three important slides. All three charts which you are studying, all three charts are described here. And you can see whatever you were reading is part of your exam. They can ask these questions in the exams as well. Okay. So now if you are done with this topic, I want you to use all this knowledge and tell me what this chart is about. While you're diagnosing this chart, I am reading the question. Affected means disease, not carriers. Yes, yes, Mr. Affected means showing the disease. For the carriers, we only use this word carrier. Okay. Seems like everyone is following the lecture so well that you can diagnose it very easily. No skipping of generation is here. And in one generation, you can see when the father was having the disease, he can affect both genders. And when the mother was having the disease, she is also making both genders affected. That means it's an autosomal disease. Okay, firstly, it's an autosomal disease. And secondly, guys, this is dominant because there is no skipping of generations. I want you to diagnose another chart. Yes. Should I provide help? Okay. So the parent number 2 was showing the disease. 1 and 2 parent is having 2, 3, 5 children. 2, 3, and 5 number of children are from these parents. And 2 of them are showing the disease, male and female both. Further, male was affecting both of his children, and female was also affecting one male baby. There is nothing like only one particular gender is affected, and all the generations are showing the disease, no skipping of generation. So answer I'm having from the students is AD, autosomal dominant. Well done, guys. Well done. This is autosomal dominant. Another one for you. Here we can totally see the skipping of generation phenomena. Can you see parents are showing the disease, they are affected, but children are disease free, no disease at all. Then children are showing the disease, but parents are healthy. Okay. Here also, parents are disease free. Nobody knew that two of their children can show the disease. So both of the parents must be carrier that they transfer the disease into the babies. Okay. And here also parents are disease free, but one of the child is having the disease. So this is generation skip. Very good, very good. This is skipping of generation, and both of the genders are involved. So we will call it autosomal. And this is a recessive condition because of the pattern we can see. Well done. That means you can solve the questions in the exam very easily. Another one. In this question, guys, we have this very, very big hint. They have given you careers. So right after seeing a career in a chart, you will say this is a recessive disease. Right after seeing a career in the chart, you will say it's a recessive disease. It can't be dominant disease with a career. Career state is only present in the, well done, recessive diseases. Career state is only present in the recessive diseases. Okay. Seems a good answer. Both genders are involved. Skipping of generation is present here. We know the career state, but these carriers are, we know that carriers cannot show the disease. They have marked them as carriers in the chart, but they are not showing up the disease. So these parents, these two parents were healthy. They were disease free, but they are producing two children, which are showing the disease, and one is carrier. So both genders are involved. That means this is autosomal recessive. Is this clear so far, Dr. Maliha? Everyone tell me any questions regarding autosomal dominant inheritance, autosomal recessive inheritance, you can ask, because next we are going to start X-linked dominant and recessive inheritance. Yes, Dr. Aruj. Any question you have, any question regarding autosomal inheritance pattern, you can ask. Now, guys, we have this topic X-linked dominant and recessive inheritance. And before starting this topic, I want you to give me some information. The information you learned in your school life. Okay. Let's see how much you remember from your school days. Let me connect The laptop. Okay. What is the significance of having both genders involved in offsprings? Yes, Dr. Maliha. Autosomal chromosomes. Autosomal chromosomes are similar in both genders. Okay. Sex chromosomes are different in both genders. So if you want to identify, yes, autosomal or recessive, no, we are not going to identify the dominant or recessive from this. We are going to identify if this is a sex-linked disease or it's an autosomal linked disease. Okay. You will tell me if this point is clear to you because this is very important. Yes. 1 to 22 chromosomes are autosomal and they are similar in all the genders. Now I want you to have a look on this chart. This chart is giving you this feeling that they are not interested in giving you the gender at all. Look at the both of the parents. Are they saying this parent is male and this parent is female? They are not saying this. Can you see this? They are not specifying the genders in the parents and they are not specifying the genders in the children as well. They are not talking about the gender at all because this is an autosomal disease. But in the coming slides, in the coming diseases, X-linked, you can see that mother is having this different breast and mother symbol is female symbol and father. So they have mentioned the gender in sex-linked diseases. Okay, so you can decide after going through this gender that if it will be an autosomal or a recessive, it's autosomal or a sex-linked disorder. Now, guys, I want you to read the features of X-linked dominant inheritance first. X-linked dominant inheritance. X-linked dominant, firstly, the word dominant is giving you this feeling that if parent is having the disease, the baby will show the disease. Okay? And one mutated gene is enough to cause the disease. So everything we learned about the dominant diseases is true here. So I want you to tell me this X chromosome we are going to talk about. Tell me a male is getting this X chromosome from which parent? In a male, X chromosome is coming from which parent? Mother or father? Yes, because a male is getting Y chromosome from the father. Y chromosome from the father, X chromosome from the mother. What about female? What about female? A female is getting X chromosome from which parent? One from mother, one from father. Okay, it's true. So X in a male is coming from mother. Mother is also giving X chromosome to the daughters. So both genders will be affected when an X-linked disease is present in the mother. And what about father? Father can only affect the daughters because to the sons, the father is giving Y chromosome. Okay, and there will be no skipping of generation in this chart. So you will get an idea that this dominant disease is providing the disease to all the babies if affected one is the mother, and if affected one is father, only daughters will be affected. Here, Dr. Maliha is the answer of your question that why gender is specified. When in a chart, you will find all the daughters affected by an affected father, you will quickly jump to the diagnosis and that will be X-linked dominant. I will show you how. This is how. Look at this family in which the parents are showing number 6 and 7. There is a father who is showing the disease. Okay, there is a father who is showing the disease. Both of the sons are healthy. No son is having disease, no son, but both of the daughters are showing the disease. So this chart is the perfect example of which disease? Great. This chart is perfect example of X-linked dominant diseases. Before going towards the X-linked recessive diseases, I want you to take a 2 minutes break, and while taking the break, you need to look at this chart. I'm coming back in just 2 minutes. All right, guys, I'm back and we have messages in the chat box. So yes, I told you that I'm taking a break of 2-3 minutes. So that is why my voice was not there. So I told you guys to look at this screen and these charts. I wanted you to make a comparison between the two types of diseases and two types of inheritance actually. So you can say that every time we are learning the X-linked diseases, we have to look into the role of the gender as well. Here, the father is unaffected. The father who is XY is unaffected. So from the side of father, we have healthy X chromosome, but from the side of mother, we have one chromosome mutated. Okay, we have one chromosome mutated from the side of mother, like this. Then guys, when father is having this affected X chromosome and mother is healthy, then this will be the situation. Mother is healthy. When mother is healthy and she is giving this X chromosome exclusively to the sons, and both of the chromosomes of the mother are healthy, all the sons will be healthy, unaffected, will not show up the disease. But the daughters will show the disease because they are getting this mutated X chromosome from the father. And this X chromosome is always, one X chromosome is always going to the baby girl when the father is producing children. And when the father is unaffected and mother is affected, we already decided that mother can provide X chromosome to both of the genders. So we can have affected daughter and affected son both. 50% of the times she can give this X chromosome to the babies, and 50% of the times she cannot. Why? Why the risk and transfer percentage of transfer of this X chromosome into the children is 50%, regardless of gender. Yes, because one allele is required. Very good. Parents can transfer half of their genome, half of their chromosomes to the babies. So every time she is producing a baby, 50% of 50% time there's a chance that she can transfer mutated X chromosome, and 50% of the times she can transfer this mutated one. Whenever she is transferring this mutated gene into the babies, either it's a girl or a boy, they will show the disease, and they will not show the disease if she transfers this normal genes into the babies. So this is all about X-linked dominant inheritance, and we have gotten information from the pedigree chart as well. This is all about X-linked dominant. Now we are going towards the X-linked recessive. Again, I want you to freshen up the knowledge of recessive diseases. Recessive disease means there will be carriers of the disease. Recessive disease means you need homozygous people to show the disease. And recessive disease means there will be skipping of generations. Everything which was true in the cases of autosomal recessive. But there will be little difference between X-linked recessive and autosomal recessive. There is a little difference. What is that difference? That difference is because of having only one X chromosome in a male baby and two X chromosomes in a female baby. Whenever you have only one X chromosome in the genome, every chromosome has its own functions. This X chromosome, because it's a single one in a male, he will show this recessive disease as a disease. What I have said, only one allele is required, okay? One allele is required to cause the disease, Dr. Sophia, is this about this X-linked recessive pattern? Yes, Dr. Sophia, what is your question about? Okay, in these recessive conditions, which are X-linked, guys, the male will show the disease. The male will show the disease. Why? Because he is having only one X chromosome in his genome for the function, all the functions which X chromosomes have to perform in his body. If the female is having one X chromosome mutated, she will become the carrier of the disease. She will not show the disease unless she is having both X chromosomes mutated. Tell me if this point is clear to you, Dr. Aruj, Dr. Maliha, Dr. Lishba. Tell me this thing. Yes, Dr. Salma. If this point is clear, then we can read further because this is very important to understand. Because in the chart, we are going to ask if this disease is recessive and person who is male is having one X chromosome only mutated, then why he is showing up the disease. Okay, good. So if the mother is affected and she is having X chromosome, the cases will be different. If she is having one X chromosome mutated, she will transfer this X chromosome to the girls and the boys both. But only males will show the disease and females will not show the disease, they will become carrier. And if there is an affected father, he will transfer the disease to the male or not. An affected father of this disease will transfer the disease to the male or not. Not at all, because he will transfer Y chromosomes into the male. So if he is having this disease, he will only transfer the disease to the daughters. But daughters will also not show the disease. They will become carriers. They will become carriers of the disease like this. Like this. And there is no son-to-son disease transmission. So in a chart, in a pedigree chart where you find a mother giving the disease only to the sons and sparing the daughters totally, no daughter will be affected in that generation, you will quickly jump towards the diagnosis of X-linked recessive. I'm showing you that chart. I'm showing you that chart now. Yes, this is the chart. Can you see there is a mother? This is the mother. She's giving birth to 1, 2, 3, 4, 5, and 6. Okay. She has got 6 children. Number 1, 3, and 5 are males, and 6, 4, and 2 are females. Strictly, the disease is affecting males of the family. That means if she is sparing all the females, she can make them carrier of the disease, but only the males are getting affected. That means, guys, this is X-linked recessive. Okay? Are you following this? This kind of chart you see in the exam, but you will diagnose X-linked recessive. Okay, good. Now let's have a look on these X-linked recessive situations. Again, you have unaffected father having no disease at all and a carrier mother this way. Mother is giving the X chromosome to the daughters and the sons both. Daughter will become the carrier, as I told you, and son will be affected with the disease. Okay? But when the father is affected, he cannot give the X chromosome to the male babies at all. So the male babies will be saved from the disease, but both of the daughters will be carriers of the disease and they will also not show the disease. So 0% chance of transferring the X-linked disease to the children from an affected father. See, we're talking about gender a lot. Here, we're talking about gender a lot because these are sex-linked diseases. Both of these situations are clear. Can we move ahead? See, these charts, when father is affected and giving the disease on the left side of the screen, guys, you can see when the father is affected, this father, he is only affecting 4 of his daughters, strictly sparing the son. So this is X-linked dominant condition. And another formula for diagnosing the X-linked recessive is this, that female mother is affected and she is only transferring the disease to the male babies, then it will be X-linked recessive. If you learn these two lines, you will easily diagnose all the charts. What are these two lines? That affected father is only affecting the daughters in an X-linked dominant condition, and affected mother is only giving the disease to the sons in an X-linked recessive condition. Learn these two formulas and you will never make a mistake in the exam. Okay? Let's move to the X-linked dominant disorders. The diseases which are involved in this kind of disorders are vitamin D resistant rickets, X-linked hypophosphatemia, Rett syndrome. Most cases of Alport syndrome are X-linked dominant, and incontinentia pigmenti. And X-linked recessive disorders are red-green color blindness, muscular dystrophy, Becker muscular dystrophy, and hemophilia. Okay. Again, I will tell you that learning the names of these diseases is very, very important. Now, Y-linked inheritance. I want Dr. Saud to tell us that, please, Dr. Saud, guessing he is part of meeting. Yes. Dr. Saud, Y-linked inheritance, what do you think? Can this disease will be present in females or not? A Y-linked disease? No. Y is only for male gender. This is a very simple concept. Yes. You will not think about it for another minute and you will say no. A Y-linked disease cannot affect daughters. It will only affect males, and it will affect all the males of the family. If father is having this disease, then he can provide the disease, he can transfer the disease to the male babies, all of them, and daughters will be spared. Then this affected male will transfer the disease to his sons, and this way it will continue. No female in the chart will be having this disease. All the males will be showing the disease. So this is a very easy and easily identifiable kind of disease, and you will be lucky to get a chart like this, which will be about Y-linked, so, because it's very easy to diagnose. Okay. So what are the features of Y-linked inheritance? Affected father. Only sons will be affected. Daughters are healthy. All the daughters are healthy. And son to son disease transmission is there. Son to son disease transmission. In X-linked recessive inheritance, we studied that there is no son to son disease transmission. So I want you to use your brain and tell me that why there is no son to son disease transmission. You just discussed this. Yes, because it is X-linked. Very good. Dr. Millie has got my point. It is an X-linked disease, and a person who is having XY chromosome and he is going to give this Y chromosome to his son only cannot transfer an X-linked disease to the son directly. He will make his daughter carrier. That carrier daughter will produce a son who will be having this disease. Recessive needs two genes. That actually is not our point, Dr. Misbah, Dr. Arsa Misbah. It's actually not our point here. We are saying that an X-linked disease, X-linked, we are talking about X-linked disorders. An X-linked disorder cannot be transferred from a male to another male. Why? Because male is transferring only the Y chromosomes into the babies. We're done with this violent inheritance here, and some obstructive spermatogenic failure disorders are related to, non-obstructive spermatogenic failures are related to violent inheritance. And now we are talking about mitochondrial inheritance, which is the last topic of today's discussion. And here I want you to understand first, actually, you will tell me first. Mitochondrial inheritance is about mother or father. From where you inherit mitochondria? From mother or father? If you know this thing, this mitochondrial inheritance is also very easy for you to understand. Mother, very good. Very good, Amber. Mother. So you are getting mitochondria from mother. That means if there is an affected father, no child can inherit this disease. So in a chart where the mother will be showing the disease and all her children will inherit this disease, it will be mitochondrial inheritance. And when all the children, she is having like 4 children, 2 daughters and 2 sons, and from that son, the disease will not be inherited further. Let me show you this thing in a chart. This is the chart. So we are having this mother, for say this is mother number 1, and she has got 4 children. All of them are showing the disease. See, all of them. And this male, he married to a lady who was healthy, and this male is not transferring the disease to the children. All 3 are healthy children. But when there was a female child, this female child who got the disease from her mother is transferring the disease to all her children. How this chart is different from autosomal dominant? Tell me how this chart is different from autosomal dominant chart. Mom is culprit. Yes. Gender specificity is not there. Okay. She is also transferring to male, okay, in AD. Guys, this part of chart is everything you need to understand. In an autosomal dominant disease, this person with a dominant disease will definitely transfer the disease to one or two of his babies. Okay, this is not skipping of generation. Sophia, this is not skipping of generation. There is no hidden disease in the babies. The disease was ended here because this guy cannot give a mitochondrial disease to his babies. A mitochondrial disease is only transferred to the babies from a female. This lineage, you can see this lineage, a mother, her daughter, then the daughter is again affecting all the babies. And what other difference is here? We are discussing two differences. That firstly, this male should, first difference is here, first difference. That this male should affect one or two of his babies for making this autosomal dominant. And what is the other difference? That if one mother is affected, there is 50% chance of having normal baby and 50% chance of having a diseased baby when she is producing a child. But in this chart, guys, you can see all of the babies are affected. All of them. That means it's not a dominant disorder only. That means it's mitochondrial. So these two differences are making this chart different than the dominant one. Okay? If you mark it dominant, I will kill you because I made you learn this very well. Now, guys, Leach syndrome and MELAS, this is another kind of syndrome, are the most common mitochondrial myopathies. Here we are done with reading all kinds of inherited disorders, and we have solved pedigree charts as well. We have learned how to solve a pedigree chart in the exam. What are the differences between different kind of inherited disorders? And we have also learned that pedigree charts are not scary ones. Pedigree charts are not the monsters who will eat your scores in the exam. They are just like riddles. You have to make some very basic concepts. You have to keep some very basic points in the mind to understand that how these charts will be solved in the exam. Again, this is a tricky topic, guys. This is a tricky topic, but if you make concepts, it's an easy one. So if there are any questions, just tell me. Thank you, Dr. Sophia. Thank you, Arsa. Thank you, Alishba. Thank you, Sahar. Thank you, Dr. Maliha. I'm so happy to see that you all learned very well. And definitely there will be more sessions like this. Having a question about starting date of course, it's 15 September, guys. 15 September. Thank you, Dr. Amber. Thank you, Dr. Saud. So from 15 September, guys, we have shared the schedule already. From 15th September, we will start topic-wise study. And we have already, thank you, Dr. Salma. We have already started, thank you, Dr. Nera, the recourse discussion in the Telegram group. And again, I'm repeating this thing. Yes, there will be recording available for this lecture. Don't worry about it. So I'm repeating this thing that whatever exam you are going to take, whatever exam, if this is FCPS, if this is an entry exam for Gulf countries, if this is a PLAB exam, or if this is Royal College exam, any exam you are going to take in your life, firstly check the past papers, what kind of questions they ask in the exam, because again, they don't want you to become an expert of genetics. They only give 9 to 10 questions from this part of the syllabus. So you should know what is the weightage of scores from each subject, and then you prepare for that subject. And this way I have prepared my students always, and I never I never let them make this mistake that they are spending a lot of time on unnecessary or unimportant topics. And we always focus on the major ones. So the study plan is very much promising. All of you will get fair chance to solve a lot of questions, mostly the important ones from major topics. I'm saying bye bye for to all the colleagues and all the friends here, and we will meet in the discussions now in the study room, inshallah. Bye bye, guys.